The procedure is a very safe procedure, but any procedure has risks. What are the risks of getting a colonoscopy? One of the risks is the risk of sedation. Anytime you're sedated, it can interfere with your breathing, it can interfere with your heart rate, it could interfere with your blood pressure. So we monitor all of that during the procedure as if you were having an operation. If there's an anesthesiologist or a nurse or myself monitoring that, we do that very carefully. If necessary, we can intervene and give medications to reverse the effects of the anesthesia, or depending on the medications we've used for anesthesia, we can stop the medicine going in, and in a very short amount of time you'll wake up. So that minimizes that risk. There is a risk of bleeding. In order to minimize the risk of bleeding, we ask you don't take any aspirin or any of these anti-inflammatory medications like Motrin or ibuprofen or Aleve or Advil for about 5 days before the procedure. That minimizes any risk of bleeding if we have to remove a polyp. The only other risk, which is major, would be a risk of bowel perforation. That's if inadvertently, as we're doing a colonoscopy, we make a tear in the lining of the colon. The chances of that are extremely small. 1 in 1,000, maybe 1 in 5,000. But it can happen, so we're very careful. If it happens, it would require surgery to fix. And sometimes we may not know right away that it has happened because it may be a microscopic perforation. But it's something to be aware of and something to know and something to watch out for. Mm-hmm. The symptoms would be a lot of abdominal pain or fevers or chills or something that wouldn't be right, and we'd give you instructions on how to contact us if any of these things were to happen. Mm-hmm. Again, the chances of these things are extremely small, and the benefits of the procedure far outweigh any of the risks. That's why it's recommended for everyone to undergo this exam. The benefits, of course, being colon cancer prevention. So we can actually save lives by doing colonoscopies on time. A lot of times we may go and do a colonoscopy and not find any polyps, which is fine, but if we do find a polyp, which happens a lot, and this polyp turns out to be a precancerous polyp, then we can remove that polyp and hopefully prevent that colon from turning into a colon that has cancer.